On today's call, we have this session specifically designed by Atrium Health, the Women's Business Institute, and our partner in program host agency, the North Carolina Institute of Minority Economic Development. Hey, Dominique, how are you? Hey, Deborah Williams, how are you? So today we're talking about strengthening your supplier base during the COVID-19. And we have with us today Thomas Stith with the SBA. He's going to share some information and data around the lender program and the resources for from the SBA. We also have with us today Mr. Kevin Price with the North Carolina Institute, who is now our new president and CEO. And he's going to share with us some information in regards to minority small businesses and a survey that the Institute has conducted. We also have with us today Mr. Les Maginley, who is the Vice President of Supplier Diversity for our very own hosting company, ATRIUM. And so it was his desire to want to reach out to his supplier base today to give an overview of COVID-19. And so we partnered with them to do this, and we're so happy that we're here to help and support in this endeavor. We also have Dr. Emily Cooper, who is with Atrium. So at a little later on, she's going to be joining us and helping us to understand the ramifications of mitigating the transmission of the COVID-19. And then you will have me. I will come on and we will talk a little bit about the business resources that we provide with the Women's Business Center of Charlotte, and to give a little overview of COVID-19. So at this time, I would ask that all my presenters and panelists unmute yourself and they can come up. Linda? Perfect. Hi, Thomas.
Hello, how are you this afternoon, Natalie?
Good. So Thomas, thank you so much again for joining us here. A month ago, it would have been unfathomable to think and imagine that a relatively small federal agency like the SBA could erect a loan program the size and scale of the PPP in just 1 week. The dedicated professionals at the SBA worked around the clock. We know there were a lot of things that took place almost exclusively from remote locations to stand up this program, and they did it 3 days ahead of schedule and 10 days to the deadline stipulated in the CARES Act. So congratulations to you. You're a wonderful team, SBA. As everyone knows, we are funded by the SBA. Thomas, we wanted you to take this opportunity to give us some oversight and talk to us about what you understand small businesses are wondering about as it relates to the funding, and sharing with us some information and data around the two lending programs.
Well, Natalie, again, thank you for the opportunity to join today's webinar. I want to thank the Women's Business Center. You know, obviously you're a very strong resource partner with SBA, and we appreciate the work you do throughout the community. We are in the midst, as you know, of a global pandemic, and while it has an economic impact, we also have to acknowledge the impact it makes on our communities at large. So we welcome you as a strong partner as we respond. Thank Atrium as well for participating today. And many small businesses may know SBA from our typical work. You know, our mission is to help support businesses to start, to grow and expand. But some people don't realize in those cases when we have disasters, SBA is very engaged with those small businesses that have been impacted. And that's where we find ourselves now. While it's a historic response, SBA has responded to natural disasters before. Today, we are just going to briefly talk about 3 of our major initiatives, 2 in particular that are relevant as we speak to our response to the COVID-19 pandemic. The Paycheck Protection Program, as you mentioned, Natalie, was stood up within 1 week of passing Congress. It has turned into over a $650 billion initiative. The program is solely designed to provide financial support to small businesses and nonprofits, including faith-based organizations, to provide them a financial tool to not only maintain and keep their existing employees, but also to have a component that will help assist with their ongoing expenses such as utilities, rent, lease payments. So the Paycheck Protection Program has an incentive within the program to provide for a forgivable clause. Small businesses and nonprofits work with the lending community, their local banks, credit unions, to apply for loans. And these loans, when approved, can be forgiven to a certain amount based on expenditures from those small businesses. The 8 weeks after receiving that small Paycheck Protection Loan Program for the small business, if they utilize 75% toward payroll expenses, 25% can be utilized for utilities and lease payments, that combined amount therefore becomes eligible to be forgiven. Therefore, the small business or nonprofit doesn't have to pay those that amount of loan off. So it is really an incentive for small businesses to provide that income and then to have a forgivable clause.
Nice.
The Small Business Relief Fund is designed for small businesses that have existing SBA loans. You can request a 6-month payments to be paid by SBA direct, and therefore that small business will not have to pay that principal and interest for a 7A loan or a 504 loan. And then finally, the Economic Injury Disaster Loan. Small businesses across North Carolina became eligible for the Economic Injury Disaster Loan, or EIDL, on March the 18th. This was the first time in history, and certainly current history, that all 100 counties in North Carolina were declared a disaster. And this provided the opportunity for small businesses to provide for these loans that are designed to help with operating expenses. They can be 30 years in term, 3.75 for businesses, the interest rate, 2.75 for nonprofits. And also an additional grant benefit was added with the March 27th passage of the CARES Act. Small businesses, as they apply for these loans, can request an emergency advance. And that really ends up being $1,000 per employee, up to $10,000. And this is in the form of a grant. So if the small business is approved for the advance, they don't have to pay those funds back, regardless of the outcome of their injury disaster loan. So the two key initiatives that I want to give a little data on now would be the Paycheck Protection Program and the Economic Injury Disaster Loan. So let's go to the next slide and see just how we have seen the Paycheck Protection Program benefit the nation, but in specific here in North Carolina. There were 2 phases to the Paycheck Protection Program. One, the initial funding was $349 billion nationally. Here in North Carolina, we had businesses, almost 40,000 businesses receive $8 billion in funding through the Paycheck Protection Program, through that approval process, over 1.6 million applicants nationwide. One of the lessons learned from the initial Paycheck Protection Program funding was to ensure that we had smaller businesses, smaller nonprofits, having the ability to access the capital. So in round 2 of funding, $310 billion, there was a $60 billion allocation to smaller asset-sized banks and credit unions. And the goal was to ensure that smaller entities, small businesses had access to capital. And we're seeing those results now. One thing I want to emphasize, there is still funding available for the current round of Paycheck Protection Program. As of this morning, over $100 billion is still available. North Carolina businesses to date have received over $12 billion in approved funds. That's about a little over 106,000 applicants have been approved. Nationally, as I mentioned, while we have a little over $100 billion left, $191 billion already approved to 2.6 million applicants. So significant, obviously, need in the marketplace for this type of financial tool. We're seeing results of some of the policy changes around one, seeing the average loan amount now is about $73,000 as opposed to about $206,000, $207,000 in the first round. So that letting us know that smaller entities are accessing the Paycheck Protection Program. And then finally, let's look at a few results from the EIDL, or the EIDL loan. Nationally, as I mentioned, we are seeing results from the EIDL. And granted, this process has been a slow process because of the significant demand that has been seen during this program. But nationally, about $11.5 billion has been approved so far. That's over 78,000 small businesses and nonprofits. Here in North Carolina, we've seen over 2,000 applicants approved, about a little over $312 million for the EIDL. And remember, those are grants. We've seen here in the state over 77,000 approved and about $263 million. One important thing to remember, last week, the portal, SBA portal for EIDL grants and loans was open for our agriculture community. In the second round of funding, they were approved to be eligible for EIDL loans. So they are now applying for this initiative. So as we can tell, between the Paycheck Protection Program and Economic Injury Disaster Loan Program, significant amount of demand, significant economic response from SBA. So I'll pause here now, and I know we have a full program and opportunity for Q&A, but I do want to mention, as I said at the beginning of the presentation, we have strong resource partners. The Women Business Center here in Charlotte is among 4 overall across the state. We encourage small businesses to utilize our small business centers, women business centers. The Small Business and Technology Center Development Centers are available to help with technical assistance, preparing for the loans. We have small businesses that don't have banking relationships. So we have a listing on our website, the district website, that provides a list of lenders, not only banks and credit unions, but our fintech community, that non-banks that are now lending and available for paycheck protection applicants. So Natalie, once again, I really appreciate the opportunity to participate and look forward to the discussion throughout today's webinar.
Thank you. Thank you for that, Thomas. And I do want to say that we have seen some success with several of our clients that have gotten access to both all 3, actually, the EIDL, as well as the EIDL Advance and the PPP. So I think right now we're registering at about 1.1 million in helping and supporting small businesses to access the funding. I know there's going to probably be a lot of questions on funding, so I do want to let people know that we just finished and concluded a session on with an accountant on funding and how do you track those funding. So please follow us at the Women's Business Center because we have more upcoming sessions on that. I do want to address Clarence for one quick session. He does have a question here. So if you completed your application or you feel like you can't find a bank, the funding, as Thomas said, the funding is still open. I think you said there's still $100 billion left, correct?
Correct. As of this morning, and obviously that's a rolling figure, but there was well over, with the close of business, there was on yesterday, well over $100 billion still available in funding. That's nationally for the Paycheck Protection Program. So if you have a small business that is interested in applying, certainly talk with your lender. If you don't have that relationship, we have resources listed on our district office website of general banks, credit unions, fintech organizations that you may apply to.
Absolutely. So Optus Bank is definitely one of the banks. US Bank also has some funding. They're still taking application. Bank of OZK, the Self Credit Union. So you want to find someone that's local in your community because the small local banks are also doing that as well. So at this time, thank you so much, Thomas. We're going to thank and welcome Kevin Price with the North Carolina Institute. Kevin, thank you so much for joining us today. And it's exciting to have you lead the North Carolina Institute. And you are newly elected president, and I've worked with you in the past, will similarly work with you in the past with Novon in the council. We know that you have approximately 14 years of working experience with minority businesses in the capacity. And your most recent tenure was a senior director of supplier diversity and performance for Novon Health. So Kevin, first and foremost, we want to ask you a couple of questions. Can you tell us what has been your experience with working the minority businesses, number one, in the past? What have you been hearing as the major issues for small business owners, especially as it surrounds COVID, right? And then in response to COVID, the Institute recently conducted a survey regarding the impact on the small business community. Can you share with us some of those results?
So Natalie, thank you for the invitation for me to participate today. And before I answer your questions, I'd just like to thank Les and the ATRIUM team for partnering with the Women's Business Center and the Institute to hold this webinar. So I really appreciate that, Les. And Natalie, thank you and your team as well for what you're doing in the Charlotte market. For some reason, I'm always trailing Thomas. So I'm getting used to this. He's pushing my game a little bit here. But Thomas, I really appreciate you always being responsive to us with webinars and providing great information to help small minority businesses throughout and women businesses and others across our footprint. So we really appreciate participation. And thank you all for being here. You all know the Institute has been in place since 1986 to really provide an avenue to increase and build the asset base of minority populations and communities. And so my experience really goes back 26 years to when I was in community development as a practitioner, working with minority businesses, building affordable housing. So it goes back quite a ways. And what I've been seeing from a MBE perspective is really that MBEs tend to be smaller and more nimble, which is a competitive advantage that you have. The challenge is that often what we're finding is minority businesses tend to be smaller, and by that I mean sole practitioners for men, and they tend to be undercapitalized. So when you have that combination of them being much smaller and being undercapitalized in a economy like we're experiencing now with this type of crisis of this image, that gets magnified and becomes even more of a challenge for those small businesses to survive. So what you have seen is we're operating in a triage mode right now, just trying to provide resources to keep minority businesses alive so that we can then start to think about post-triage. And that's really where I am at this point, is someone needs to now start thinking about those of you who will survive this, because you will survive this. But you may come out a little banged up and a little bruised. So how do we now start thinking post-triage so that you can thrive again someday? So I'm really thinking more in that regard. What I'm hearing a lot of minority businesses and small businesses mention to me is that there still isn't enough resources out there from a grant perspective. So I appreciate Thomas talking about the resources that are available from the SBA. And I think there's still opportunity for more resources to be available. And what you all are seeing is the state recently responded with a state stimulus package last week. And in that package was $75 million for historically underutilized businesses. Those funds will be funneled out through the Golden Leaf Foundation in partnership with the Rural Center and its partners, which tend to be community development financial institutions and other banks that are partnering with them in that process. The Institute will also play a role in that by providing technical assistance to those businesses. So some of what you're used to seeing through our Women's Business Center will continue to provide that support statewide as well. And Natalie asked me about the survey that we conducted. And this might be a good time to show that slide. You all, I've been with the Institute now for 60 days. And generally you have this landing when you come in where you get orientation time and get to know the staff, understand policies and all of that. And I experienced none of that. This was really a crisis almost day one. So I had roughly a week before COVID-19 hit us and hit us hard in terms of the Institute having to respond and respond effectively. So one of the things we did was we brought together stakeholders across the state, and I think Dominique was on the call, and I know others who participated in the survey were instrumental in us developing just questions needed to be asked of minority businesses and small businesses across the state, so we understood what you were up against. So what you see here are some of the results that were uncovered during the survey. We knew that most were sole proprietors, most sole proprietors, not many, but most. 90% of them had fewer than 10 employees. So these are very small businesses. And over 50% of them in business over 50 years, over 5 years. So that meant that they are not startups. They've been in business for some time. They're contributing to their community. And we have to respond in a way that will keep them alive and thriving. 62% experienced a loss of revenue of somewhere around 50%. Now that's significant when you think about it. Half of your revenue is gone. So how do you sustain your business and keep your employees in place? Thank goodness for the SBA being there to provide revenue or resources to shore up some of that. So that's been helpful. But 70% of them are still functioning. So they're finding ways of using existing resources to pay staff and keep them in place. But we knew that a third of them were very close to being on the brink of having to do something drastic, like either close their doors permanently or start to lay off staff members. Well, that 30 days was last week. So we're now in a period where we're seeing what is happening. Now, fortunately, the SBA funds have kicked in with now a second wave of funding for those really smaller businesses who were able to get in on the first round. We're starting to see that relief come to them. So that has been incredibly important to see that happen. But also what I was hearing from many of these businesses is there's a lot of emphasis around loans, given that these funds or their revenue is not returning. There needed to be a little bit more emphasis around grants. So part of what I'm hearing in some of the discussions with state are around how do we provide more grant opportunities, and maybe not at the larger amounts that Thomas mentioned earlier of 70,000, but for those who need micro grants or much smaller grants just to get them through a short period of time. So there's been a lot of effort around that. And so the last thing I'll mention to you is from a resources perspective. You've got the SBA resources are still available that Thomas mentioned. But beyond that, you also have the state stimulus funds that will come online, and you will have access to those, particularly if you missed the SBA funding. That is targeted for you. And then I'm noticing that cities across the state are also responding to some type of loan or micro loan or grant product to shore up those businesses within their city. Charlotte has partnered with LISC to do some work in that space. Raleigh has done some work there. And I'm hearing other cities do similar things. In Durham, you've got Duke that is leading a fund there. So there are lots of resources out there for you. And on the news website, we've tried to list some of those resources that are available on one of our web pages called COVID-19 resources. So feel free to use that as you look for resources that will help support your business. We know you're going to be successful. We know you're going to come out of this alive and well. It's now just making sure that you have those resources to thrive again someday. So that's where we are in terms of making sure you have those resources available.
Thank you so much, Kevin. That PowerPoint slide, you guys are doing that, you said, on a quarterly basis now, that information?
Yeah, so Natalie, the first survey was conducted back in March. We are gearing up for the second survey that will be conducted later this month and will be unveiled in June. And we'll continue to do those every quarter the rest of this year because we need to understand real time what's happening with small diverse business and be able to provide that information back to those who have resources so they can respond appropriately.
Awesome.
So please, as you see that survey come out, take the time out. We've been intentional about not making it long and difficult to fill out. So please take the time to respond to it so we can help you.
Thank you. Thank you so much. And did you mention the marketplace? I don't remember hearing that. I apologize.
So marketplace is how we start to think about post triage. So on the marketplace website of the Institute's website, you will know that we've got two things there. The first is our emergency relief fund, which is focused on those small micro grants of $1,000. And currently we're receiving funds in. So once we get to a certain dollar amount, we will start giving those funds out. And the second thing you'll notice there is a campaign we're driving, which is about buying local, buying small. I'm hearing from a lot of citizens across our state that they want to support you as a small business and they want to buy your products and services, but they may not know who you are. So we thought it was important for us to use a tool that many in the supply diversity world use to connect their buyers within their corporation with diverse businesses who have the product or service. So we use that same platform. Any of you can go in and register, so be found in that portal for free. Citizens within the local community can go in there and search for you for free and buy your products and services. So we encourage you to register in the portal so those in your community can find you and buy your products. So thanks.
Thank you. Thank you, Kevin. Appreciate that. And we will have a few minutes after the sessions to address a lot of the questions that are on the side of the chat, as many as we possibly can. So at this time, I'd like to say thank you for your vision and for putting this together to Mr. Les. You are a great resource for supply chain at ATRIUM. You wanted to provide a safe place to share, hear, learn, and listen about information around economic climate with the COVID-19 for your supplier base. And so congratulations for you for putting this together. You are the executive leader with the largest healthcare system in the Southeast, with an annual gross revenue of over $8 billion, skilled in operations management, lending large multidisciplinary teams, diversity and inclusion. So tell us a little bit about, Les, why you wanted to put this together and what would you like to share with your suppliers today? And then what is ATRIUM's position in supporting their suppliers during COVID-19?
So yeah, thank you. First of all, I'd like to also thank Kevin Price and the Institute, as well as Natalie. Thank you guys so much. This is so important. Part of the vision was, with Kevin, I called Kevin and I said, hey, Kevin, I think some of our suppliers are having a rough go at it, especially our small minority businesses. I think it's an opportunity for us to do something. I said, I'd like to maybe host some type of webinar, get all of our suppliers together. Let's find out what's keeping them up at night. What can we do to support them? So Kevin and I talked about, first of all, I have to say this on Kevin's behalf is he was like right away, let's do it. I know someone who could help us with this. I think it's a great idea. Let's get it done. So that was the first thing. And then we talked about some grant funding that, ATRIUM can help with, because what I didn't realize is sometimes $300, $400 of a grant can help a small business that may be struggling just to make payroll. And I think oftentimes we really don't understand or realize that, if a company has 2 or 3 employees and they just need to make it to their next payroll, every little bit helps, right? So when Kevin shared that with me, I was kind of blown away because, when you think about grants, back what Thomas was talking about, you're thinking about thousands and thousands of dollars. Well, sometimes some of our colleagues don't need that much. They just need something to get them by. That's what kind of drove the passion for me, because I know, as I talk to some of our suppliers, I know they're struggling. They've shared that with me. And so I want to keep as many as we can, as possible. And I know, I share statistics sometimes with our leadership team and things like that, but, we do a certain percentage of our total book of business with our minority companies. We do about 30 to 32% of the business with those suppliers. And so I really wanted to make sure that number wasn't reduced, because we've worked really, really hard over the last year trying to get our supplier base up. And I think over 2018, I think we increased our minority supplier base over 100%. But I don't want to lose the momentum that we've captured, because I think it's very important. It's very important what ATRIUM's doing in the community. It's very important what we're doing, what Camille Copeman and her group is doing. Fernando Little, who is now the Chief Diversity Officer, he's very engaged. And we do a great job on the other side of making sure that our underserved communities are well taken care of from a health perspective. And I just thought it would be important that we do this from a supplier diversity perspective as well. So what we've been trying to do, Kadra Green and myself, Kadra is my supplier diversity manager. What we've been doing is really reaching out to our partners, as we call them, our vendors, and making sure and asking those questions. And they've been reaching out to us as well and asking those same questions. So we have to do, so what I would ask for the suppliers is continue that dialogue. If you're having issues, you're having struggles, let us know, because there are things we can do internal that might be beneficial. So for example, we can, and say, okay, you're on a 30-day net payment term. Maybe we need to be on a 10-day net or a 5-day net. What are those things that we can control that we can help with our small businesses? So, when I hear people say there's really nothing we can do, I kind of always cringe about that, because there's always something we can do. I mean, we're all in this thing together. And the best way that we can move forward is we got to help our small businesses out, because I know they're hurting. I know they're struggling. I thank God for Thomas and what he just provided, because, a lot of our small businesses, from when I've talked to people, they don't understand what's available. They just don't have a good appreciation for what's out there. And not only that, how to access that money, and what does that mean for them? Hey, will I have to pay this back? Is this a grant? Because the last thing that we want to do is we want to put people in position to say, okay, now you just got this $50,000 loan, grant, whatever you want to call it. They're confused about it, but most of them may not ever be able to catch up from that loan after this is all said and done. So like Kevin said, we will survive, but I love the partnership between the different institutions and everybody working together, whether it's the city of Charlotte, whether it's AMP Up. I see, Jerry Ann on the call. No matter who it is, whether it's Dominique and the CV, MSDC, I mean, whoever it is, we're having these conversations almost on a daily basis. And I think we can certainly make a difference. And we at ATRIUM, we're passionate about what we do. We're here to help people. And that's why I decided to make sure that this was important. This was held. It's great to see that there's, over 120 people on the call. So hopefully somebody will be impacted by this.
I believe they definitely will. And kudos to you, because at the Women's Business Center, we have been working with so many different clients on so many different levels. And it's amazing. What is really amazing is that everybody's situation is different. I mean,
Absolutely.
Even if we're doing 300, 400, 500 calls, everybody's situation is different. And I always tell people, like my father's told me, there's no such thing as a dumb question, right? You got to get an answer. And if you have to answer it several times, then that's what we're here for. We're here to help and support. And again, you're right. Kudos to the SBA team, Thomas, for providing the information. We do go a little granular in our data.
Sure.
So when people have questions, we're able to help them with those questions.
And Natalie, if I can say one more thing, I just,
Sure.
I just want our minority suppliers to know that Kadra and I are working extremely hard on, we have quite a few RFPs coming up this year that we're working on. We're right in the middle of a promotional items RFP that we were able to get 15 diverse suppliers to the table. I believe 5 of those are minority. So we're really pushing hard. We feel like this is a category that we can award someone on this, maybe on this call, or a couple people on this call with some, you know, some more business with Atrium. So we just got to do our part. We've got office supplies coming up, got a lot of different things coming up. So I'm going to be calling a lot of people, pounding the pavement. So will Cadra, to try to make sure we get these categories as jam-packed as we possibly can, so that we can, you know, we can certainly help during this time.
That's excellent. And one of the things that we talk about even during this time, because it's new, right? People say new normal. I don't use those two words together. I just use new, is joint ventures. You know, with you having these great opportunities, these are, you know, an opportunity for small businesses to partner together to see what piece of the pie that they can take to help to fulfill those types of contracts. And so, yeah, I'm hoping that, you know, we can get together as a community and talk more about joint ventures, and that there become a format and a session on teaching small businesses how to move forward, how to read contracts, you know, on establishing those joint ventures. So I think that would be one of the ways that can add back to your supplier base as well. So is Dr. Emily on the call? Is she going to be available, do you know, today? Because if not, I can move right on to what I wanted to talk about, and then we could probably go ahead and answer some more questions. But I do want to give her an opportunity to talk about mitigation of the transmission of COVID.
Yes, let me, I think she's—
I'm here. Can you hear me?
Great.
Oh, let me turn on my video. I'm here. I've been here the whole time. I've enjoyed all of the
Awesome.
presentations.
Thank you so much.
So sorry, now my screen looks different. It looked very different before, but it looks like I'm officially in here now. I don't know where I was before, but I've heard everything.
Well, good. Well, you know, welcome to this format. And on behalf of the Women's Business Center, I want to say thank you for your time and your talent. Wanted to give you an opportunity to talk about what you're seeing in the community from a small business perspective, as well as just from a community perspective. And how are you advising your clients or your customers and patients on mitigation of the transmission?
Okay, great. Thank you very much. First, I'd like to thank you all for inviting me to join this discussion today. It seems that ATRIUM has kept me busy with things like this, but I love it. I hate that it had to happen during COVID-19, but I am the medical director here at ATRIUM Health Middle Point, which is located just outside of Uptown, right across the street from Johnson C. Smith University. As you probably can imagine, ATRIUM Health has been tracking the numbers and looking at where our surge was going to be, which is the highest peak of patients, and immediately kicked into high gear, changing the way that we were operating. Immediately changed the visitation in the hospitals. We changed the visitations and restrictions in our community, in all of our clinics, not just our community clinics. And as physicians, we even changed the way we practice and see patients. We went from having, 100% of our visits as in-office visits to now I've had to get some of my older physicians up to speed on virtual visits and how to do a Zoom chat and, send this link to your patient for virtual video visits as well as phone visits. So it's a very different time. And I like what you said earlier, that you no longer say new normal, it's just new. And it's new for all of us. So, we are, my friends who are physicians, and certainly among ATRIUM Health, we're all closely monitoring everything that's going on. So I did prepare based on the questions that were sent to me or what I was asked to speak about, some things that small businesses can do to protect their employees. And what I prepared, I kind of tried to look at it from a few different points of view. From the point of view of entrance to your workplace, from the employee point of view, the workplace physical building itself, meetings, break rooms, monitoring, and then a couple of miscellaneous things. So I'll try to make sure I stick to my time, and I should be able to do that. So first, as far as entrance, consider pre-screening. prior to entering the building. What does that mean? Check temperatures. I know that those infrared thermometers are a hot ticket item. I'm still trying to get one for my church, actually. But if you can check temperatures, if you have to get the one where you use probe covers, at least that's something. And consider asking about symptoms. Have they had any fever, any cold symptoms, or exposures to people that they know have COVID-19? Next, give a mask at the entrance if possible. Again, I know masks are in short supply. Definitely know that working in healthcare. Or what we're now doing is if we have patients who come in that have their own mask, that's acceptable as well. So consider that. Next, if you are a business that would have visitors, not necessarily customers coming into your building or work area, really thinking about, do you need to have visitors, and those visitors that are necessary, let them know your procedures before they show up. And then finally, for entrance, develop policies and procedures for immediately isolating people who have signs or symptoms. You know, are you going to send that employee, you know, back to their car immediately? Are you going to put them in a room? So thinking about that. Next, from the employee point of view, understanding that you may have employees that are high risk, meaning that they're immunosuppressed either from cancer. There's certain medications that can cause a person to be immunosuppressed. Patients with diabetes, heart disease, lung disease, and your employees who are over age 65. Consider your plan for those people. Are you just going to have them not come to work with a note from their doctor? I know a lot of us are doing that, but just thinking ahead about that. Is it possible for you to have staggered work shifts? And if not, looking at the number of people that you have in one building or area, making sure your employees have their own equipment and don't have to share. Or if they do have to share, set up a cleaning schedule. You know, if person A uses it from 8 to 12, can you let that clean and sit until somebody else comes at 4? And then consider factoring in more breaks if your plan includes having your employees wear a mask all day. It's tough wearing that mask all day. So, you know, maybe let them get a 5-minute break at the top of every hour just to go outside and get fresh air. Next, from a workplace perspective, frequent hand washing for at least 20 seconds. You know, my daughter's 4 and she was watching something, and Elmo tells us we can sing ABCs and that's your 20 seconds. So I like that. That's easy. Everybody knows the ABCs. So that way they know it's been 20 seconds. And always wash hands when visibly soiled. Even if you don't know what's on your hands, just go ahead and wash them. Having hand sanitizer stations if possible. They need to be alcohol-based with a minimum of 60% alcohol. Provide plenty of tissues and trash receptacles in the facility. Schedule regular housekeeping practices, including routine disinfection of surfaces and equipment. Next, under meetings, your first question should be, why can't this meeting be virtual? What about this meeting has to be done in person? Look at the multiple platforms that are available, like Microsoft Teams, Skype, Zoom. There are a bunch out there. Many of them are free based on the number of people you'll have. If an in-person meeting is necessary, look at where you're going to have it. Can we have it in a place where we can have people 6 feet apart? Can we consider meeting outside if the area permits? As far as break rooms, similar thing. Set up your break room to maintain that 6-foot distance. Consider alternatives like taking lunch in the car. And I'm not sure, just quickly, if people understand why the 6-foot distance is important. It's because we know that when someone sneezes or coughs normally, so not a forceful one, that what comes out of their mouth or nose can travel a minimum of 3 feet. So if you have someone with a really forceful cough or sneeze, it can go 6 feet or more. So that's why you hear that 6-foot distance a lot. Next, stagger lunches and breaks to try to decrease the amount of people in the break room. I know my time is winding down, just a couple quick things. Monitoring, if you have a person that's reporting a cold or fever symptoms, what is your company's plan? Have you thought about how long you want that person to stay away? A couple of recommendations, if they're just your basic cold symptoms, consider sending them home for at least 72 hours or until no fever. If, when possible, I know people will try to take advantage of this one, but try not to require a doctor's note. because that just kind of clogs up our system, phone calls or in-person visits. Certainly if you have someone who's abusing that, then you would use your judgment with that. If someone has reported to you contact with a COVID-19 individual, 14-day quarantine with testing. ATRIUM does have roving mobile testing sites that they release each week. So there's no appointment needed. The evaluation is done on site. And in fact, they actually have a social worker there who can assess, is that person coming up in need of other services? And then the last thing under monitoring, consider developing a flexible but consistent sick leave policy and let your employees know that and keep it aligned with public health guidance. Really quickly under miscellaneous, I put a culture of safety. If our employee is sick, we want them to stay home. I see a lot of people during flu season who tell me, I have to go back to work, I can't stay home. So consider having that culture of safety in your offices, because again, you're looking out not only for your employees, but also for your own family with that. Think about how you're going to deal with employees who think this is a hoax. There are still a lot of people out there, amazingly, who think it is a hoax. Have a firm policy in place, have your signage, and just remind your employees the goal is community respect and responsibility. We have to keep each other safe. We have to keep each other healthy so we can do the same for our families. And then finally, support your employees, because they, along with you, have multiple concerns right now: their pay, their leave, their families, their safety and health. So if you don't have access to some sort of employee assistance program for mental health and emotions, consider aligning with local organizations, which I'm sure that the Women's Business Council has that information. So I will stop there. Thank you very much.
Oh my God, I could fill up a whole book. And I don't know if everybody else was writing as fast as I was, but I'm going to tell you that was so thorough. Do you have any of that in writing where we can get that? Okay, perfect.
I do. I typed it up, so I didn't leave anything out for you guys.
I love it. I love it, because there are so many people that have so many concerns, and they're so fearful about returning back to work. You're in an elevator, they're saying no more than 2 people, no more than 4 people, but you got 400 people that are coming in and out of that building consistently, touching things and stuff. And I know, we've had people come to the office, they were sick beforehand, So I like the fact that you talked about establishing a culture that talks about being healthy, So I'm a germaphobe, so there we go. Thank you so much. That was very useful. I would love to, I'm going to solicit you for the Women's Business Center.
Sure. I was going to email you afterwards anyway.
Okay, thank you. So at this time, we can bring, I'm going to talk a little bit about some of the resources that we provide at the Women's Business Center. And then we're going to open up for questions and answers. So Linda, if you can just put up our first slide. What we've been hearing is a lot of small businesses are having a very difficult time in obtaining funding. Some people here wrote in the response that they had an application. Some of their applications weren't approved. Oftentimes what has happened is that the applications, not that they have not been approved, but the packages have not been what the banks have needed as it relates to the PPP. So one of the things we want to talk about for general purposes, in general, when you're going for lending, make sure you have a business plan, you have contribution at least 10 to 20%. But when you're looking at these predicaments like today and where we're at with the pandemic, you want to talk about making sure from an emergency standpoint that you have all your tax documentation prepared. So if you started your business and you were in business as of January the 15th or February the 15th of this year, we are hoping that you have the ability to have had prepared your Schedule C or whatever type of business that you're in, or at least you have had your 2019 tax documentation. That's going to be number one document that you're going to need when filling out the applications for the PPP and for the EIDL. Also, you want to make sure if you had contractors that were working for you as a 1099, that you have filed those 1096 documentation, right? Because you cannot consider a 1099 as an employee. They are exactly that. They are a 1099 contractor. So you want to make sure that you have payroll documentation that specifies W-2 employee information, and that you have an accounting system that specifies the 1099 information, okay? Also, you want to make sure that you have had, or that you have filed, the IRS 940 and the 941. Linda, the next slide. In doing so, as we move forward, so that's on the financial side, and I'll get a little bit back to that in a few about the numbers. Moving forward, what you want to make sure is that you have consulted with an HR consultant. The doctor had given us great advice on things that we need to do when opening back the business and bringing employees back in. So one of the things she talked about is having a policy. You must have a new policy and procedure manual updated in your company. That needs to talk about the testing, and your employees need to have that knowledge and be informed, so they'll know what the processes are and what they can expect, so that there are no litigations about, well, no one told me. So you want to make sure you're talking about HIPAA laws, testing, when and how someone can be tested, what those sick leaves are. She talked about making sure, you having to have flexibility if someone appears or comes to work and they're sick and they have a mere cold or they have a fever. What is now going to be your processes that you're going to utilize moving forward? Also, she talked about the telework, asking yourself that vital question, even if it's a meeting, why can't this meeting be done by telework, right? Customer service is another thing. So within your organization, devise a new plan. You're engaging with your customers on a different level now, because everything is a little bit more virtual. You're not going to be able to talk to them face to face per se in the same room. What is going to be your new customer engagement strategy? So look at that from an HR standpoint and get those processes in place as well. Everyone knows that the supply chain has been disrupted. This is a disruption to everybody's supply chain. So what does that mean to you? If you have a supplier that was supposed to bring you a product that you were supposed to deliver to someone else, what is now your new processes? What are the processes that you're putting into place to talk about the logistics and how that is going to happen, right? And how are you going to notify, which means that now you have to create a new communication strategy, right? So you have to talk to your customers and your vendors in that format. ATRIUM is a person that you do business with, so you want to make sure that they understand the processes that you put into place, the processes that you're following going forward, and how will you satisfy the contract that you are now under obligation with them. Okay, so now you need a new vendor management system as well. So setting up a system moving forward is going to be extremely, extremely important. Linda, our next slide. What we want to talk about is building the financial resiliency. So you need to build a platform so that you can create a very strong structure. Some of our customers that we have dealt with did not have a strong financial platform, meaning that they didn't have any financial management systems, whether it be a QuickBook, whether it be a Solomon Brothers, whatever that is, they didn't have it. And if they did have it, they were unfamiliar with their numbers. So build yourself a financial resiliency program. Take advantage at this particular time of companies that are offering free training. We're encouraging our customers to do that. There are free softwares out there, and there's also free training on bookkeeping, accounting, and CPA functionalities if you don't already have a CPA. We also talked about join or partnership with a partner to do a special project. So even if you cannot handle the project because maybe you had to let go some employees at this time, look for some people that you know have an ethic that you have, the same culture that you have, and join with them to go after a very good business project together, right? And they are adding value to you. Value add is extremely important. Okay, so when you're doing these joint ventures, you have an opportunity to tap into their employees. You have an opportunity to tap into different resources, reaching different demographics, and you can reach different areas of the country. So one thing we always talk about from a financial standpoint is understanding the ramifications of your payroll. The PPP was designed to be a payroll protection program. What has happened is a lot of small businesses were not paying themselves. So they didn't have a record of a payment. So going forward, make sure that you, one, have established a separate bank account, but also that you have established a system of payment for yourself. Understand how much money you're going to need on a monthly basis, even if you do not have clients. That's going to need to be your next strategy going forward. If you don't have clients in 4 months, what is the strategy for the business to keep a revenue stream and sustainability moving forward? And continually stay on top of your budget and know your numbers. Also, one of the things you might want to look at is repackaging the types of services that you're offering. This will help to bring some type of resiliency in your products, right? So you might have had a package that was $5,000. Can you decrease that product or that package to be offered at $250? Okay, Linda, the next slide. Get an understanding of contracts. So what we're seeing here is that too, small businesses have buildings, they've got commercial property, they're renting property and things of that nature. We're asking you guys to sit down with your lawyers. If you don't have a lawyer, we do have some resources available for pro bono services, especially as it relates to COVID. How do you understand the contract that you're under now? As far as the rent is concerned, what do you do if you're not getting income coming in? So going forward, make sure you understand the language that is in your contract. Often small businesses thought that they had a liability policy and that policy was going to help pay them back some type of revenue. That's not the policy that will do that. So get with your insurance agent and understand the ramifications of the policies that you do have, right? Seek out new business opportunities for growth and talk about the contract language as it relates to your HIPAA. Next slide, Linda. So this is my favorite slide of all slides, is to understand knowing and understanding the numbers. So oftentimes people say, well, what numbers are you referring to, Natalie? So I'm talking about your market analysis number, your startup budget, your break-even number, the numbers that is going to help to sustain your business, even if you do not have any businesses or revenue coming in. So understand your cost of goods sold, understand what the depreciation is, understand what your net profit and your net worth is. Linda? And there are some free resources with the census. There's free resources at your library to help you to figure out some of these different numbers. And I think lastly, I think this is my last slide. Small businesses, get around you with a trusted resource. Your banker, your lawyer, your accountant, your insurance agent, and your financial advisor. It's going to be critically important as you move forward in this new, that you have an intimate relationship with these individuals. Some of the issues that we heard from a lot of banks or the small businesses not able to get lending is because initially they didn't have a relationship. Then it was open to those individuals who didn't have a relationship and who weren't unbankable to make sure that they were seeing other community bankers. But it's going to be important going forward that you have that relationship. So we provide resources at the Women's Business Center of Charlotte. We're there for you. Linda, can you just flip? We do over 100 workshops throughout the year. Most of them are free. We also provide professional development training as well. We have a Sip of Monday motivation on Instagram Live. It's offered every Monday. We do a midweek lunch spotlight where we're talking to our community leaders so that you can be empowered. We want to bring this information to you. We have a Did You Know chat, and we do a Forward Focus Future virtual session as well. And then we have a Monday night highlight session. So we're here for you at the Women's Business Center of Charlotte to provide you the resources that you need. We also do business startup workshops, and we have sessions on LinkedIn, social media. This may be a format that you have to continue to use. So if you don't know how to use it in your business, there are several training sessions that are online that can give you that opportunity to do that. So find us on Linktree at linktr.ee/WBC Charlotte, and we're here to help you. Thank you so much for your time. At this time, because I want to stay with our time frame, I want to bring back the entire panel. And we want to open the floor for questions in regards to anything that our customers may have. Thank you, Thomas. Les, thank you. And Miss Dr. Cooper. I'm in love with Dr. Cooper already. So we do have a couple of questions, and as much as that is within my possibility, I will answer them. What I do suggest is that if you do need additional service and counseling, you can reach out to us at the Women's Business Center of Charlotte, because we can provide you a little bit more detailed information. So Mr. Fisher started out with the first question, which was, I missed the first PPP program. I have my PPP application completed, but cannot find a bank or financial institution that is still accepting them. Any suggestions? So Thomas, I'm going to defer to you with that, and then I can back up with some information.
Sure, I would suggest if they, the individual has already talked with their existing lender, to access our website, sba.gov/NC, sba.gov/NC. We have a listing of all lenders in North Carolina that are affiliated with SBA, that are participating in the Paycheck Protection Program. There's also a listing of organizations called fintech companies that are non-bank entities like your PayPals, your Intuit, that are also working with SBA. So there's a broad pool of potential lenders that the questioner can view on our website, and it's under lending resources on our main website. So that would be my recommendation. We have seen in this second round, and certainly in the first round, but more prevalently in the second round, community banks have been very active with the small business or smaller business community. So would suggest for them to review that list and to see what may be available through that resource.
Absolutely. I definitely know there are some CDFIs, which are the community development institutions, which are like the self-helps, US Bank, Optus Bank. There still have opportunities, Bank of OZK, and these are banks that are on the list that Thomas just referred to. So please feel free to utilize that resource. Kevin, do you have any other suggestions that you want to speak about in regards to lending opportunities?
Yeah, I just wanted to mention, Natalie, since you mentioned self-help, there is a office of self-help, a branch of self-help in Charlotte. I think that is Randolph and Providence Road, near Randolph and Providence Road. There's a Harris Teeter there on the corner. It's right beside that. But I had some conversation with them earlier this week, and they are looking for more small businesses that need the support and help because they've got capacity. If you need that support, if you got your packet together and you're just looking for a banking partner, I would suggest you reach out to self-help.
Perfect. Yeah, Claudie Johnson and Donetta at that office, because they did reach out to us and tell us that they do have that capacity. The one thing I do want to say is make sure that you have, if you are an LLC, make sure you have your Schedule C documentation as well as your bank statements. Also, make sure that you have your 940s in order. So when Kevin is talking about putting that package together, those are the documentations that you're going to need. The other thing that I want to make sure people understand is the tracking system. So there's no science about how you are spending this money, correct? So we have some documentation that we can provide to you. If you give us your information, or you can email us after this, that will help you to track, if you have received the funding, help you to track these 8 weeks of how you have spent this money. Because what you want at the end of the day is to make sure that you are shoring up your numbers to the SBA and that you are clearly aware of how it is that you're deviating these funds over this 8-week period, okay? So we do have some documentation that can help and support you with that. So Kevin, thank you for saying that about, the self-help as well. So I have another question here. I applied for the EIDL early, and mostly these will probably be EIDL numbers unless someone has some questions in regards to health, but we'll get to them at the bottom too. I applied for the EIDL early. I have not received any updates nor the 1,000 per employee. However, many who applied after me received funding. What can I do? Thomas, do you want to address that? Or?
Yeah, I would still, and actually not to get too deep in the weeds, but the EIDLs are processed through the Office of Disaster Assistance, not obviously the local district office.
Right.
So I can provide, and Natalie, you probably already have those that information to contact ODA or Office of Disaster Assistance directly. It has been a significant response on the EIDL. So I empathize with the caller. Some of the early applicants are still going through the review process, but there are two direct numbers to Office of Disaster Assistance, along with a customer service email that they could inquire just to see the status of their application.
Awesome, thank you. So we also have a couple of questions here. Just how long does it typically take? So it's generally going to take you as long as you have the opportunity, the right documentation. It just depends. It just depends on the banking system, and it depends on you being able to respond back. Some people have applied and gotten a quicker response, but it really is no defined time period. So someone says they applied for the first round, but still haven't heard back. I've been assigned a number with the EIDL, but nothing for the PPP yet. I have sent in all my documents. So one thing I do want to say is this, is if you have already applied for a PPP, you can, and you haven't heard anything, you can reapply for a PPP. What is going to happen is if you go to a different lender and you do apply for a PPP, it's going to kick up something within that system. So you're not going to get double paid. So if you applied at, let's just say, for example, you applied already at Bank of America and you went over to Aquesta Bank and you said, I wanted to reapply. If you reapply, it's gonna mesh. The systems are gonna talk and it's gonna tell you, hey, you already reapplied. So now Bank of America or whoever else may now give you a call because it now is bringing that application back up. As far as the EIDL, that portal right now is closed and it is only open to those that are in agriculture business at the moment. So if you haven't heard anything exactly back from the EIDL and you did not, you would have gotten a number at the end of the application once you hit the submit button, and then you would have gotten a letter later to say, something in regards that we have gotten your EIDL and the amount of money that you would be approved for, and you just would have to check yes or no. So as far as the EIDL, I would just say just maybe wait a little longer, but for the PPP, if you have not already applied, you can reapply because the system will mesh together. Okay.
And Natalie, I'm smiling because we have spirited debates in our office about what you just said. Okay. On multiple applications. I actually am on the team that says it's a timing game, so you better apply as often. But one caveat, and on a serious note, best practices will say, one, you're right. If you have applied with Bank X, I would first ask them, are you going to submit my application? Where am I in your review process? If they're not going to submit or you're not getting timely response, you do have the option of utilizing other lenders. But from a best practice point of view, keep track of who you've applied to, because we've had some challenges. Individuals receive a loan and they don't know which bank it is. Yeah. And so keep track of that. And if you receive an SBA loan number, that will be the key. You can get an application loan number from a bank, but that doesn't mean your loan has been funded. You need to ensure that you've received an SBA loan number. That means it has been received final approval. Talk with the banks that you applied with previously and withdraw your application, just as a best practice. Right. But the first round of funding was exhausted in 14 days. This round, we're seeing a much more paced distribution of funding. As I mentioned, over $100 billion. While that's a big number from where I come from, it won't last forever. So you do need to be mindful and manage that application process and communicate with that lender.
Thank you.
Thanks for that clarity, because I was hearing a lot of small businesses talk about putting in as many applications as they could with various banks And when they got approved, they didn't know where to go,
Yep.
which bank it was from.
Exactly. You need to use some measure of, it's a balance, you know, obviously you want the opportunity while it exists, but at the same time, as you just said, Kevin, you can get yourself painted into a corner as well. And you need to manage it in a good best practice manner.
Mhm. That's good. And that's the same goes for, and we too have had people get confused over where they're getting their funding from. Some people are saying, oh, I got my money. And I'm like, well, where'd you get it from? And they're like, oh, I don't know. So it is a best practice to make sure that you're logging that, but also because you want to make sure that you're going to track that documentation, you know, and move forward with the business in a good way, especially over that 8-week period, so that you're not doing what is considered double dipping, right? So you don't want to be penalized, and you want to work as smart as you possibly can by spending at least the 75% of those dollars on your payroll, and the other 25% on the things that would make it forgivable. Not mortgage, but interest, right? Rent and some of those utilities. We had a call earlier today. Someone said, well, I'm a sole proprietor and it's just me. Well, then can I spend 100% of my money on payroll? Well, if you're a sole proprietor, that would be the expectation if you didn't have any rent or any other property somewhere else, okay? So I don't know if anybody else wanted to bring anything else up. I know there's a lot of questions here on the side that we could really get into the weeds with. But I don't know, Les, if you wanted me to go ahead and proceed with some more questions, or. Yes, okay, good. Thank you, I appreciate that. So we have a question here. If you received the grant from SBA EIDL, how do you learn whether they are offering a loan? Well, I have to go back in and submit for a loan, or was this automatically processed when I submitted initially, which is what allowed me to receive the grant? So what has become a little convoluted and not really clear. Thomas, do you want to address this, or did you want me?
Sure, I can answer that. It sounds like the individual applied for a EIDL, an Economic Injury Disaster Loan. During the course of that application, it's literally toward the end of the process, you check a box and say, yes, I'd like to be considered for an emergency advance. That will be evaluated along with your EIDL, and actually that will be evaluated first. So it sounds like they did receive the grant, and that's direct deposited. So they received the grant. Their EIDL, the full loan request, is still it's still being processed. So if they've received the grant, there is nothing proactive they need to do. The full loan is still being processed, and they could eventually move forward and be approved for their full EIDL. Unfortunately, there's some scenarios where you may receive the grant and not receive approval for the loan, but you still obviously can keep the grant proceeds. So at this point, they've received the grant and their full application is still being processed.
So Thomas, I'm glad you said that, because there has been some confusion a little bit in regards to the EIDL advance and the loan and the PPP. So can you speak a little bit about if someone did get the advance, the 10,000 or up to the 10,000, and they also were approved for the EIDL loan, which is the back end, and they also received the PPP. Can you talk a little bit of what happens to the advancement at that particular time?
Sure. Stepping back a moment, one question is, can I apply for both? And the answer clearly is yes. May I receive both? Yes, you may. The key factor to remember, and Natalie, I'm glad you're working with small businesses on record keeping and accountability, because the key point with receiving both is you cannot use the proceeds for the same use. So the Paycheck Protection Program is clearly designed for payroll if you want to activate the forgivable clause. So if you were to receive both, you certainly would want to maximize utilization on payroll. The EIDL can be used for operating expenses, so be extremely careful on use of funds so you don't have duplicate use of funds. If you receive both, the grant portion will be realized over on the PPP side. So in other words, if you received a $5,000 advance, that would reduce the amount of your PPP, but you wouldn't have to pay it back, but it shores up in the accounting. So one, you can receive both. Two, be very careful on use of funds because you can't use, if you receive both, the full EIDL and PPP, you can't use them for the same use.
Awesome. Thank you for that. I do have one question, and I think this is for Kevin. What is the governor doing it, or there was a question, what is the governor saying about opening the state back up so we can start to get back to normal? So Kevin, if you want to address that, Thomas, or even Dr. Cooper, anyone.
Well, from my perspective, and I'm sure Thomas and Dr. Cooper, you can weigh in as well, obviously, but from my perspective, the governor is opening the state back up in a phased approach. And there have been several committees that he has engaged to offer some advice to him, both from the perspective as well as on the business sector of how best to do that, which sectors of business should open at which times, just from a security and safety perspective. So we are thinking through that and offering some advice to the how best to do that. I guess my question with Dr. Cooper was more around as we do open up, and if there is a case of COVID-19 that is identified in terms of an employee of a company, has there been conversation with healthcare providers around how best to support those businesses so that the outbreak doesn't become full blown versus isolating it within that company, and maybe providing some direct support to that company to test all of their employees quickly to make sure we isolate it?
Yeah, great question. I personally haven't seen anything specific. I am participating in a COVID-19 task force with other individuals. And what I would say first is definitely the public health department would be involved. Certainly if workplaces or employers put into practice some of the things I recommended, they would be the first ones to know. So getting that information to the public health department to assist in that effort is key. The second piece is being very acutely aware of who has come in contact with that individual so that they could be made aware of that immediately. And then the third piece, as far as reopening, from a physician point of view, it's difficult when you're talking to your colleagues and people who are outside of the medical profession, because some of the things that we know about COVID-19, and there's still a lot we don't know, that is very scary. And I think if you polled 100 doctors, we would all agree that everybody's opening way too soon. But we're also sensitive to the fact that, you know, the economy, people are struggling financially. So how do you weigh that? The governor and his committee have a very difficult job. All the governors do. So it's keeping those lines of communication open, staying in touch with your public health department, staying in touch with even your primary care physician, because those are some of the questions that we ask. Who have you been in contact with? Does that person know, especially when people are positive? And as far as ATRIUM Health, the other piece that we're doing, the extra layer, is there is intense monitoring of patients who are COVID-19 positive who are not in the hospital. So there's a whole team that is over that sector of patients that we're monitoring. So there definitely has to be the open lines of communication for that.
Awesome, thank you. I think if we have room for one more question, and I'm going to ask, it says, I'm in sales and travel to visit potential new customers in the IT resellers. in the state? How do we get out of the visit? How do we get out to visit these companies in different areas of North Carolina? So Dr. Cooper, I think that will probably be something that you might want to address from a safety or perspective.
One of the things I would do as you're setting up the new visits is to ask those people, the people you're going to visit, do they have any safety precautions in place? Once you find that out, I would still go prepared and armed with your own mask. We do recommend that the homemade masks that are cloth made, that a lot of people are making right now, I would have one of those if you don't have one of the surgical masks available. And we really want to keep those for our healthcare professionals. I would have a mask. I would have your own hand sanitizer. I would be very aware of what you touch. Obviously, sometimes it's difficult not to touch a door, but either washing your hands while you're in their site or immediately after, and immediately after, and using your hand sanitizer. But those are the main things I would do. Finding out their safety practices, anything that they put into place. And I would even add how many people are going to be involved in your visit from their end, being aware of how many people you may take with you to try to limit that interaction, and then having your mask and your hand sanitizer with you.
Can I offer one more?
Please do.
Suggesting that men shaking hands and women shaking hands is a thing of the past.
Yes.
So, you know, I had a gentleman come up to me recently. First of all, he was closer than 6 feet, so that was an issue. And then as he kept getting closer, he went to shake my hand, and I said, no, we're not doing that anymore. And I didn't want to offend him, but I was like, you know our environment. That's just not safe to do anymore. I don't even want to do the elbow thing. It's just too close. So I think we just need to be sensitive with one another, that we're colleagues, we're cordial with each other, we can smile at each other, nod, all of those other gestures, but just physical hands, we should stop that.
Absolutely agree. I'm a hugger. It's hard.
It is hard. I'm a hugger too.
Really asking for you.
Yeah. I just one of these and be like.
That's why I like you, Dr. Cooper. Is Les, are you going to join us back again? We've got thank yous in the panel. I know we didn't have an opportunity to get to all of the questions. I believe we will download this documentation, and I think we have everyone's email address because you registered for this event. And what we'll do is, some people have asked for the tracking document that we have. They've asked for the information that you provided, Dr. Cooper. So what I would like to do after this is I will get with Les, and I will get with Kadra. Kadra, thank you, Kadra. I will get with Kadra, sorry, and we will get that information out to you. So at this time, we are on time. We're at 2:59. Does anyone have anything that they would like to leave with our constituents before we release this meeting? Any last minute thoughts?
Natalie, I'd just like to thank you again, the Women's Business Center and ATRIUM for this excellent forum. The key now, given the environment we're all working in, is information, and the exchange of information and the willingness to be engaged, not only from a small business perspective, but as I mentioned, for our community's well-being. So again, thank you. And we'll put another plug in. If businesses, nonprofits have an interest in the Paycheck Protection Program, significant funding still available, and working with the Women's Business Center, I know they can go through those charted waters and become successful, and obviously with the Institute as well. So thank you both and your organizations for what you're doing.
Thank you, Thomas.
And Natalie, thank you, and Dr. Cooper, Les, Kadra, we appreciate you. Thomas, always a pleasure to be on the panel with you. So we just appreciate all of you being involved to help support small and diverse businesses across the state. So thank you.
Now, I'd just like to say quickly, thank you again for having me on. One thing I did forget to mention during the presentation and with the question that that Kevin asked is that ATRIUM has a coronavirus webpage that is updated daily. Even if you are not a patient, you can get a virtual video visit with a provider, and they are not charging for this service. So that is something to consider, you know, for your employees who may need assistance or have a question or concern. And I'll put that in the document that I sent along with the phone number.
Thank you so much. Mr. Les?
Yes, I'm sorry. I got kicked out of internet for whatever reason. Everybody in my house was on a meeting and they started screaming. So it wasn't just mine. So I guess I better pay the bill next time. But I want to just thank everybody. You know, I've learned a lot today. I mean, this has been very beneficial. Thomas, thank you so much. I hope we have some opportunity to speak again, because I think what you have is so informative. And of course, Kevin, I appreciate everything you're doing, man. And we'll get there. Like you said, we're going to survive this. It just might take a little longer than we anticipated. And Natalie, thank you so much. Dr. Cooper, what you spoke about was amazing. I appreciate it. I'll be probably knocking on your door again at some point. So I appreciate you. You know, an hour and a half of your time is very valuable. I understand that. So thank you so much for being so gracious to come and spend some time with us. So thank you guys.
Thank you. And thank you everyone for joining us, and we'll talk to you later.
Sounds good. Thank you guys. Have a great day.
Thank you.
Bye, everyone.
Bye-bye.
Be safe.
Bye-bye.